So talking about pelvic health, that I think for traditional PT, like the ones that treat more orthopedic problems, we are more scared about pelvic because that's not like our specialty area. So what do you do more specifically to the pelvic floor? Because you're talking about the core and how important is the pelvic floor in that situation. So do you do anything specific to pelvic floor, or just as a consequence of breathing, it improves too?
Well, I usually let people know that the pelvic floor will lengthen, not relax. Nobody wants organs falling out. The pelvic floor will lengthen just like any other muscle lengthens. Your bicep lengthens. Pelvic floors will lengthen in positions where you get your ischial tuberosities to move apart. And so deep squat. There are some positions that are attributed to yoga, but are not necessarily yoga, but yoga does them. But like the happy baby yoga pose, the child's pose in yoga, anything where you kind of have, or even just bringing these up to chest like this and breathing deep, taking a diaphragmatic breath is going to help to lengthen that pelvic floor. Interestingly, one of the deepest pelvic floor muscles is obturator internus, which is basically your baby sister to piriformis. So, we all talk about piriformis all the time. Piriformis lies right over that. So pelvic floor is embedded in your hip and back muscles. So just talking to patients about the fact that, here's a roof, here's a basement, your pelvic floor muscles are part of you. They should get longer. They should get shorter. If we do this breathing, if we try not to hold our breath during transitional movements, we're going to have healthier range of motion of that muscle group. And if that's all you talk to your patients about, and that's what you incorporate that essence and deep, start to do squatting, start to get them in positions which maybe get those ischial tuberosities apart. Working on the therapy ball, the Swiss balls, with just dissociating the pelvis and hip dissociation movements back and forth of the knees gets that pelvic floor to start to move a little bit. Just some things like that can get to the pelvic floor without you ever touching the pelvic floor. I don't palpate the pelvic floor in 75% of my pelvic floor patients on the first or second visit. I do all this other stuff first.